Hi, my name is Milfa Blamo, and my presentation will be on the health and environmental effects of air pollution. I chose this topic because I have a 7.5-year-old that struggles with asthma, and we were told by his doctor that air pollution, most times will trigger asthma. What is air pollution? Air pollution occurs when the air contains gases, dust, fumes, or odors in harmful amounts. Now, generally, any substance that's found or that people any substance that people introduce into the atmosphere that has damaging effects on living things or the environment is considered to be air pollution. That would include carbon dioxide, greenhouse gases. Those two are the main pollutants that warm the earth. There's other greenhouse gases, including methane, which comes from such sources as swamps, and gas emitted by livestock. There's also some CFCs, which were used in refrigerants and aerosol propellants until they were banned because of their deteriorating effect on the Earth's ozone layer. There's several different impacts of air pollution. The main one would be on the environment. Others would include health impacts, and I'm going to talk about that later. Acidic rain can cause damage to plants, animals, trees, and other wildlife. Now, acidic rain is just one component of air pollution. CFCs are another, but just kind of going back to acidic rain. So basically what happens is that the acidic rain will damage the soil and hinder the growth of the plants. CFCs are another form of air pollution. They cause harmful effects to the ozone layer, which, as we know, the ozone layer protects us from ultraviolet radiation. And so damage to the ozone would cause damage to plants and wildlife, as you would imagine, and also allow us to be exposed to cancer and other radiation risks. Our planet is currently warming much more, so when we talk about global warming, our planet is currently warming much more rapidly than expected because of additional greenhouse gases, and they're being released into the atmosphere from air pollution. Now, I want to talk about the health impacts of air pollution. First, starting with adults, because the impact will vary based on whether you're a child or an adult. Now, with adults, a recent study estimated that approximately 64,000 people in the United States die prematurely from heart and lung disease. And this happens every year due to a particular air pollution. Now, that's more people than those that die of car accidents, or what have you. Adults that work in certain professions are more exposed to some air pollutants, causing impairments over time to their lung and heart functions. Exposure to carbon monoxide by adults can cause mental illnesses, vision loss or vision damage or vision changes, as well as alertness issues. Photochemical oxidants can affect the lungs and vision as well in most cases. Now, as I alluded to earlier, I do have a 7.5-year-old that suffers from asthma. So now we're going to talk about the health impact on children. Now, children are a little bit more susceptible because they are not as their bodies aren't as developed, obviously, as adults. Children represent the largest subgroup of the population susceptible to the effects of air pollution. Among children, air pollutants are associated with increased acute respiratory illnesses. So we talk about asthma and other illnesses related to the respiratory system. Increased incidence of respiratory systems and infections, episodes of longer duration, and lowered lung function because their bodies are less mature than adults. Several studies have linked ozone and particulate air pollution with exacerbations of asthma in children afflicted with the disease. So, kind of what I alluded to earlier. Common air pollutants, especially ozone, sulfur dioxide, and particulate matter, present a challenge to those that have asthma. A significant body of scientific evidence links the increase in levels of these pollutants to worsening of asthma. So increased emergency room visits, I can attest to that. Increased medication use and what have you. Some of these investigations reveal asthma exacerbations occurring at pollutant levels at or below the pre-1997 federal air pollution standards. So basically, the Clean Air Act was a response to dealing with the situation of air pollution. This was in response to two really significant outbreaks, if you will, where in one instance there was a thick amount of air pollution and fog back in 1948 and 1952. The first Clean Air Act was adopted in 1963. The one that was adopted in 1970 by Congress was on a federal level. And the Environmental Protection Agency was also established at that point to help carry out the Clean Air Act and policy. Their goal is to reduce air pollution nationwide. In 1990, they expanded the Clean Air Act to include emissions and what have you. Under the Clean Air Act, the EPA sets limits on certain air pollutants, including setting limits on how much can be in the air at any given point and at anywhere in the United States. This helps to ensure basic health and environmental protection from air pollution for all Americans. Now, the Act also gives the EPA the authority to limit emissions of air pollutants coming from sources like chemical plants, utilities, and steel mills. Different states and tribes or what have you may have stronger policies and pollution laws, but they may not have weaker ones. And I think it's a great initiative. It's a great policy, and it's definitely a way to combat air pollution. Now, I've listed my references, and I will mention that most of the information that I've shared here comes directly from my references. In most instances, I just quoted the information there because it is pertinent, obviously to my topic, and it is factual information. Thank you.